Hello everyone, and welcome to our free statewide community education webinar. Today's topic is what matters most. And first of all, just happy National Advanced Care Planning Week. So I'd just like to start by acknowledging the traditional owners of the land of wherever we meet today and pay respect to elders past, present and emerging, and extend that respect to any First Nations people that are in the session today. And also to acknowledge any sad news or sorry business that may be happening on the lands around us as well at this time. So this session is hosted by Palliative Care Queensland. Palliative Care Queensland believes that the way we care for our dying is a significant indicator of the kind of society that we are. We have three organisational priorities, and they are that all Queenslanders are able to live every day until their last, are able to have a dignified death regardless of illness, age, culture or location, and have access to a supportive social network at the end phase of life, and the choice of quality palliative care. Now, we say that at the beginning of everything that we do so that we're always focused on the same thing for the organisation and really have our vision and our mission at the top of our priorities of what we're doing. So today we're focusing on what matters most, advanced care planning. So like I mentioned, happy National Advanced Care Planning Week. It's one big week a year. We have National Palliative Care Week and we have National Advanced Care Planning Week. So they're two big awareness raising weeks for us. So we're really delighted that we can host this webinar during this week. I should also say that my name is Shyla and I'm the CEO of Palliative Care Queensland. So really delighted that our team can bring together a discussion and start the discussion in this space. Advanced Care Planning Week runs from the 21st to the 27th of March. So it's the perfect time to start a conversation and take some time to reflect on what matters most to you and how do you have those conversations with your family and your friends that it's important to them to understand what's important to you, and also for you to understand the same from them as well. So how can you begin those things? And we have two amazing speakers today that can share some tips and some lessons from their great experience as well. And then we'll have a chance to do a Q&A session after that, so we can ask some questions as well. So now for a touch of the housekeeping, like we always do. For those of you that may be unfamiliar with Zoom, just to point out a couple of the features. If you hover your mouse over the bottom area of your screen, now just noting that some people might be on a phone or an iPad and this might be different to other people where they're located, but there's both a chat function and there's also a Q&A function. So you can put a little note in chat. And so maybe just to start, if we can all just practice by putting a note in the chat function. So click on chat. And to test this, if you could put two bits of information. Firstly, we'd love to know where you're from. So this might be a suburb or your postcode or your Indigenous lands around that space. And so if you can share something in that space, would be lovely, and just pop them in the chat function. So like I mentioned, my name's Shyla and I'm actually in Spring Hill, which is on the Yagara and the Turrbal people's lands as well. I also think it's lovely so that you guys get to see each other, because in webinars it's hard to connect in that space. So having that little message of different people around where they're located is also a nice way to connect. So if you have any questions, you can pop them in the Q&A area. So just pop a question in that area and we can answer them, and I'll save all them until the end and ask them to the panelists at that point. So now over to our wonderful panelists. I'd first like to start by introducing you to Shawn Miller is an advanced care planning clinical nurse from Metro South in Queensland. With over 10 years experience as an orthopaedic surgical nurse and 3 years working in advanced care planning, Shawn has a special interest in providing high quality care for patients specific to their personal needs. She believes that every person is unique and care provided should reflect those qualities to provide patients and families with comfort, dignity and respect at all stages of life. So the privilege now of introducing you to Shawn. Thank you.
Good afternoon, everybody. Thank you so much for having me here today. It's really quite a privilege. So, I have worked as a nurse, and I actually did the math this morning, and it's 15 years. So during that time, I have been really privileged to have cared and shared some of the most beautiful moments with patients and their families, but also some of the hardest as well. And working with advanced care planning in the last 3 years, I've really been able to speak to patients and their families about topics that we would often say, we use this word a lot, you know, maybe they're a little bit taboo or are difficult, or the classic is the later conversation, you know, we'll talk about it later. However, when we really get to that pointy end of life, it really isn't the conversations that we regret. It's often the conversations that we haven't had. So that's really what I want to talk to you all about today, and break down some of these ideas around some of these conversations. So if you could next slide, please. So this is the quote that I love. Sometimes the most important conversations are the ones that are the hardest to start. Next slide, please. So what is advanced care planning? I really like to break this topic down really simply, and what it means. So when we look at the first word, which is advanced, we really don't mean advanced. It doesn't have a D on the end. So we're not talking about advanced disease or advanced age. We're just simply talking about in the future. And the second word is care. When you are talking about advanced care planning, we really just care about your health. A lot of people will come to us and talk about their will and their funeral plans, and having all those things sorted is amazing. But really what we're interested in is your health. So care really is about healthcare. And then planning, this translates to choices. So when you put it all together and you're looking at this concept, you can break it down into your future healthcare choices. And I think that's a really great way to understand advanced care planning. And it's a good tool that you can put in your pocket, maybe when you want to start these conversations without being too complex or too confusing for anyone. Next, please. So this always leads to the next question, is why? Why do we need to do advanced care planning? And why do these conversations that we have around these concepts really matter the most? And when a patient comes into my care on the wards, if we're in hospital and a patient comes into my care, I can do all of the basic nursing things without thinking. I could do the blood pressure, I can do the temperature. But what I really want to do is tailor that care that I provide to the person that's in front of me. I don't want to be caring for bed 20. I want to be caring for Mrs. Jones, who loves spicy food and fosters cats and kittens and goes to church on choir once a week. I want to know that she doesn't want to be in hospital. She finds the walls oppressive, that she's had years of cancer treatment and doesn't want any more. And I want to know these things so that I can make sure that as a healthcare team, we can get her home as soon as possible, and we can stop some of those treatments that she doesn't want and increase those that she does. But if I don't know these things, and perhaps the time has passed for her to tell me, how can I provide the care that she needs? Next slide, please. So this is the question that I would like to put to everyone today. And this is, it's a classic question that we have out, is really, if you were suddenly injured or became really seriously ill, who would know what your wishes are? Just think about that for a minute. Who in your life would know what you would want? And what is it, those things ultimately to yourself, ask yourself those hard questions, is what is most important to you? It's a bit of a hard one to answer sometimes, but these are the questions that really underpin advanced care planning. Next slide, please. So why should we plan? So for those of you, I hope you can see these images. I want to talk about these two different images, and this is something that we see all too often happening in the hospital. And the first picture is that of an ICU bay. Now, I've worked in ICU and I can tell you that it's an extremely noisy environment. The lights are always on. There is always some machine beeping. There are lots of people everywhere all the time. There are visitors that are often limited to 1 or 2 people. And really, you know, these are not places where we want people to be spending their final moments. But unfortunately, it does happen through a myriad of reasons. But I want to think about whether or not we can do something different so that we don't spend those moments in ICU. So I want you to have a look at the other picture that's on your screen, if you can see it there. And this is actually one of our staff members. This is her nan. and she is in her own home. She has a hospital bed that's been provided for her. She's visiting, I believe that's her great-granddaughter. And I'm not sure if you can see on your screen, but there's a small drink on her table. It's 11 o'clock in the morning, and I can tell you that's not apple juice. So she's been lucky enough to have conversations with her family about what it is that she wants, what it is that matters most to her. And it allowed time for services to be put in place, plans were made, and she was able to do things her own way. And this was all because the conversations were started. Next slide, please. So the biggest challenge is often starting the conversation. And I think there are some key things that you might want to consider when you perhaps want to start the conversation with your loved ones for them, but also for yourself as well. And I think when. So when choosing your moment is really important. And a moment of calm within the chaos of life or the chaos of perhaps doctor's visits and things like that is always better rather than having a conversation when someone is ill or someone is stressed. And we have guides within the hospital that trigger us to, you know, someone meets some criteria and then that would trigger an advanced care planning conversation. But ultimately, no matter what stage of life that you're at, I really think that having a conversation early before you hit any of those crisis moments that may occur in your life are always going to be best. They are always going to have the better outcomes for you and your family, because that's who it really does affect. You primarily, but your family plays a big role in this as well. So I think choosing your moment is really, really important. Who is important as well. So choosing who to have these conversations with, who you want to speak and nominate to speak for yourself if you can't, is a really, really important step. Someone who understands you and understands your wishes, but also someone who would actually be willing to carry out those wishes in the event that they had to make a decision for you. And even if they didn't agree with what some of your wishes were, they would be able to follow that. And I think that's really key, choosing who is the best person to have this conversation with. So we have sort of covered the why, we've covered the when, and we've covered the who. But I really want to talk about the how, which is the next slide, please. So when you have these conversations, some of the key aspects is how to record those conversations and how to record your advanced care planning. And in Queensland, currently, there are 3 main ways that you could record some of these conversations, so that as clinicians and healthcare providers, we have ready and easy access to some of those decisions. Next slide, please. So I've put this slide in here to just show you that documents actually changed. It feels like it's only recent, but it was actually November in 2020. So we got new enduring documents. The Advanced Health Directive and the Enduring Power of Attorney forms actually changed on November 30 in 2020. And I really wanted just to mention that today, because a lot of times doing advanced care planning and completing these documents occurs over a period of time. And if you have, or your loved ones have started some of these documents prior to November 30 and perhaps are on the old forms, it's important to note that if they're not finalised yet, you actually need to start on the new document. So I just wanted to highlight that for anyone that may be halfway through that process. If you have an older document and it's been finalised, that's absolutely fine. This is just for documents that are maybe hiding in that bottom drawer in the kitchen. So let's talk a little bit about these documents for a moment. Next slide, please. So I always like to start with the Advanced Health Directive, because I talk about this one sort of being at the top. It's sort of the top dog. And the Advanced Health Directive is a formal, legally binding document for your health treatment that you receive in certain circumstances. So just like it's called a directive, it gives directions for those providing care for you about what you do and what you don't want. There is also a section of the form which allows you to nominate someone to make some of those health decisions for you. You can appoint an attorney for those health matters. And then you can provide additional information which may affect some of your care. And it can be the sorts of treatment that you do or don't want. It could be information about any religious or cultural or spiritual beliefs that would affect your care. And you can put all that information in this health directive. It's important to note that this is a legal document. It must be signed and witnessed by a GP and a doctor. And that is essentially part of what makes it a legal form. So that's the Advanced Health Directive that sits at the top of our little hierarchy. So following on from that, next slide, please, is the Enduring Power of Attorney form. So this too is a legal document, and this form allows you to appoint a legal decision maker, so what we call an attorney. And it also, similar to the Advanced Health Directive, it needs to be done by someone who has capacity to make those decisions. So you may choose to nominate one or more people to make decisions for you. They may make them together or they may make them separately. So there are different forms where you can nominate people to make health decisions and also someone to make a finance decision. It's a little bit of a complex situation, but it really gives you some flexibility into who you want making your decisions for you and what those decisions might entail. So within this document, it's important to note that this document is the sort that might sit in the background when we're talking about health decisions. It might sit in the background, you might have finalised it, but ultimately we don't actually use it until someone has lost capacity. So if they are no longer able to communicate their wishes and make those decisions to us, that's when we would enact the power of attorney and speak to that person or persons. But if you are still able to make those decisions and communicate them with us, then that document does just sort of sit in the background for health. That's when we're talking about for health matters. Just mention financial very quickly. There are some differences there, and you may nominate someone to be your enduring power of attorney for finance, and that may start a little bit sooner. So there are just some slight differences in the forms there that are important to note. I think that with this, as I said before, choosing who you want to nominate as your enduring power of attorney is key. So, and often it can be the hardest part. You really want someone that you can trust to make decisions that align with your wishes, but also making sure that tell them that you've nominated them as your power of attorney, and then having a conversation around what that means. That really is the key. I see a lot of patients who don't realise that someone else's family member has nominated them for enduring power of attorney, and it can get a little bit grey because the conversations haven't taken place. So make sure it's someone that you've communicated well with. Don't choose your cousin Beryl, who you haven't spoken to since Christmas 12 years ago. Make sure that person is going to be providing consent for your healthcare treatment, things that you do and don't want. So you really want to have that conversation behind you. This document does also need to be witnessed by a GP or Commissioner for Declarations or a lawyer. That will lead me to the next document, which is the Statement of Choices. So the Advanced Health Directive and the Enduring Power of Attorney, these are legal forms, and the Statement of Choices differs a little bit. It is a values-based document that we use to record a patient's wishes and preferences about the type of healthcare treatment that they would like or wouldn't like. And sorry, I just had a bit of a phrase there. It's really specific. It talks about the type of medical care that you would like, but also including some of the spiritual religious beliefs that might be in there as well. So this differs to the Advanced Health Directive and the Enduring Power of Attorney in that it's not a legal document, but the content within it is used to guide decisions. So it's a really, really good conversation starter, especially for those more complex situations. This is the document that I would often start with, because it really gets people thinking about themselves, what matters to them, and what they really want people to know. So it's an excellent conversation starter, and then potentially can lead to completing an enduring power of attorney or an Advanced Health Directive if the patient so chooses. There are two sections to this document, and there is a Form A and a Form B. So Form A is for someone who has decision-making capacity, and Form B can be filled out by a substitute decision maker for someone who no longer has that capacity to fill out that type of form. So as I said, it's not a legal document, but it is used by health professionals to guide the care that a patient will receive, along with any other information that's provided at the time. So it needs to be signed by the patient or the substitute decision maker that's completing the Form B, and a doctor as well. So there's some of the differences between those documents. Next slide, please. So where can you find these documents? So the website that you can go to get them is the My Care, My Choices website, and you can see hopefully on your screen there that there's just a little menu item down the left-hand side, and you can download all of these forms. They also come with some explanatory guides in some cases, which are a little bit longer than the forms themselves, which is interesting. But go to the website, have a look at the forms, and you can have a look and decide which forms might be right for you. The forms differ in that you might want to fill out all of them and you might only want to fill out one or two. But I think the key is having some of the conversations around these documents and figuring out which is most suitable for you. Next slide, please. So what should you do with your documents? This is a classic question that I put to people when I do some education sessions. And I say, you know, has anyone finished any of these forms? And I get a few hands that are raised. And then I say to people, you know, where are they? And the most common one is that they're in the bedside drawer or they're in the kitchen drawer. And I think that's wonderful. I'm so happy that people have taken the time to fill out these forms. But I want to ask them who is going to be using these forms, and more often than not it's us. It's nurses and doctors in the hospital at the time where something may have happened to you, and we need to actually know what those documents say. So Queensland Health, we have a really incredible statewide office of advanced care planning, and what we do is we have staff that work to review every document. So get your documents, send them in to us when they've been completed, and our staff will look through them to make sure that everything's signed where it should be, everyone's filled out all the information that is needed to make it a valid document. And then once that check has been completed, the documents get uploaded to a program which is called the Viewer. Now, the Viewer is an incredible program and it's accessible through all Queensland Health hospitals, so staff can actually access it at the time that you might actually be in their care. But it's also available to ambulance officers, ambulance service, and it's also available for GPs as well. So it allows these documents to be actually used when they are needed the most. The other thing is that I did just want to mention, some private hospitals don't have access to the Viewer yet. A lot of doctors work cross between private and public, so they may have. But if you do visit a private hospital regularly, it's important, please send your documents to us. We can check them for you and make sure that they're filled out correctly. But you will need to take a physical copy to a private hospital just in case, so that they can add it to their specialised systems as well. All right, next slide. So the best way to know someone is to have a conversation with them. And this is really the crux of what I wanted to say today, is that it's never, ever too early to document your future healthcare plans, but sometimes it can be too late. So the time really is now. Communicate your wishes to your loved ones. Get them to communicate their wishes to you. Speak with people, speak with your doctors, and document what it is that you want and don't want, so that we're able to provide care that is unique to you, and make sure that your wishes are actually followed through. And that's all. If you've got any questions, pop them in the box and I'll be happy to answer them after.
Hello, can you hear me?
We're just going to share a quick video.
Oh, good eye, thanks. Thank you.
So James is just editing that. You can see that on the screen. If it's not working, then we'll send it to everyone after this session so that you can all have the link there. So while James fixes up the technical difficulties that you can see, which is the life that we live now in a very online platform world, I'd just like to thank Shay particularly for that presentation and to give us such great, clear guidance around this space. And I think a lot of people consider documentation as the key, but what you've really emphasised, Shay, is the multi-layers of this. It's around the conversations that happen in this space, and the documentation is part of that. We're incredibly lucky in Queensland to have access to the Office of Advanced Care Planning, which is also the My Care, My Choices program that Shay is from. And it's such a unique and incredible opportunity for us in Queensland to have such a streamlined system of information and support available to us. I do believe we're one of the only places in the world that does have that access. So, really encourage people to use it, to jump onto their website and have a look at that. So that's the My Care, My Choices website. And I think the link was put up for you in the chat before as well. So again, thank you so much. And I think always this time of year, I always think, oh, I've got to recheck in with myself again. What do I need to have those conversations? Who should I be having them with? And what sort of documentation should I have in place so that we're prepared for the future? So thank you so much, Shay, in that space. Really appreciate that. So now I'd like to introduce you to our second wonderful speaker, Jeannie Chase. So Jeannie is a qualified social worker, counsellor, psychotherapist, and clinical supervisor with over 20 years experience, specialising in grief, loss, bereavement, and palliative care. Jeannie has worked over 20 years experience as a social worker counsellor in health departments, hospitals, other government agencies, and community programs in both Queensland and Victoria. Prior to that, she worked as a nurse for over 20 years. In addition to clinical supervision, she works as a consultant to 9 major palliative care teams in Brisbane and Melbourne, providing supervision and reflective practice on a monthly and bi-monthly basis. So such an important aspect of the reflective practice aspect of the jobs that people do in this space in palliative care. So really excited to have Jeannie share her wisdom and her knowledge in this area. Over to you now, Jeannie.
Thanks, Sharla. Thanks, everybody. Thanks for having me. I guess the first slide I had up there was a meerkat. I don't know whether you saw it, James, but I guess when I was thinking about doing this talk, it was because I saw this meerkat and I thought, I remember working in Victoria in paediatrics, and the meerkats there in the Children's Hospital were really just so beautiful and helpful. And it reminded me of all the families that I'd worked with there and what mattered most to them. So that's why it was there. Yeah, I've had many years, as Charlotte said, working in palliative care and working alongside lots of amazing people. And so, I was thinking about what mattered most, when I was thinking about all the people that I've worked with and the staff that I've worked with, but in my own life as well. And, listening to Shane, thinking how amazing it is, and Charlotte as well, about having, so much now focused on advanced care planning and health directives and documentations where people can actually talk about this stuff. But when I was thinking about, so I'm not going to go down that track of all, what should happen and what we could be doing within health systems. I guess I wanted to look at the most important things that I think that I've found was most important for people, and always came up with relationships, be they with pets or their people's gardens or children or families, but it was a relationship, or even a relationship with their own body. And always the most important thing was about getting to understand that, And of course, all these relationships can be wonderful and difficult. There's all connections to memories, there's past hurts and resentments and conflict, history of abuse and trauma. It sounds pretty heavy, but they're the sorts of things sometimes that, you know, that kind of connect us to what conversations we might have. And you know, sometimes it's all very simple. Like if we just say this and do this with our families, then we'll get the best care at the end of life. And often that's not the case, because there's this heavy burden in people's lives, or inability to speak about maybe what's important. And I've actually seen that many times in families where somebody might be dying and they're talking about what they're eating or what might be, you know, going to be happening, and the real issues, the real conversations aren't happening. So I actually looked at, you know, the importance of actually contemplating our priorities, and, you know, the importance of knowing what we want at the end of life, or even what we're wanting now, what's most important to us now, you know. And if anything, like, you know, we just sometimes don't get a chance to get seriously ill and know that we're dying, to have the conversations. I mean, death can happen to us anytime. So it's actually that awareness and willingness to actually contemplate on what might be needed in our own lives. Maybe the next slide, James. I'm just going on. So, you know, knowing what maybe needs to be completed, you know, who we want to be around us, who will be our advocate, thinking about things, having these conversations. What gives our life meaning now? What relationships need to be addressed? Who in our life do we want around, you know? And particularly at the last time in our lives. The next slide, thanks. So I think Shay talked about it as well, having early and continuing conversations. And I want to tell you a story about, you know, I guess it's a sad story in a way, because these stories didn't happen. It was these conversations didn't happen. And I remember this beautiful young woman, Anna, and this is a long time ago, but not that long ago. She was a 27-year-old woman who had melanoma, and she was dying, but of course her family didn't want her to die, and nobody wanted her to die, of course. And so there was, the only conversation that was being had is what next treatment that she could have, you know, what new treatment was available for somebody who was 27 years old. So it was the oncologist, it was the nurses, it was the palliative care teams, all palliative care team differently, I guess, all kind of not wanting to have the conversation about the fact that she was dying. And there was only an opportunity, one tiny little opportunity that was had for her to speak directly to someone about that she knew that she was dying, that she knew that her family couldn't cope with the fact that she was dying, but could I just put down the things that she would like to happen after she did die? So there was this real, you know, if the culture, if there was an understanding, I guess, that we all die, and we can die when we're tiny and we can die when we're old, and that these conversations might need and do need to be had. And I get, well, not need to be had, but it would be lovely to have had that to happen. So I guess the importance for me then was that, well, what's really important to me? What do I need to know? You know, what do I need to really access in myself that's important? And then be able to have the conversations. And also the only way to know what is important and right for anyone else is to ask what matters most to them, to have the conversations, and these conversations really needing to be be an open, you know, discussion around a table when you're having dinner. And of course, you might say one thing, you know, 1 minute, and that this is what I would like to happen, but it changes over time. These decisions will change over time. But I really wished at least Anna got a chance to actually say something, and actually it did open up a little bit more of conversations at the end of her life. Next slide, thanks, James. So of course, the benefits of early conversations are help with further decisions over time. You've got an idea where people sit with different things. you know, therefore you can actually do an advanced care plan. You can, when it's offered to you, there's a clarity in your own mind and your family's mind about what is needed and the help that will give to organisations. And it can improve the delivery of culturally appropriate and person-centred care. And I remember another little story of a family, somebody's watching the time, another little family who had this beautiful woman. She was Iraqi woman and Muslim religion, and she'd have 4 stillbirth children who had died, and this was the 5th one, and because she was connected to palliative care, so then she was able to have the conversation that really when her baby, she could actually stay with her baby, she could hold her baby, we then understood that when the baby died, that the father would then come in and do all the, you know, the rest of the process. So there was this, because of our ability to have the conversations, she was able to get 5th time some really appropriate person-centered care, you know. And then, you know, there's so many families that I can talk about, you know, that once those conversations had, there was the intention about how they would then spend the days and weeks and years. Also amazing, these conversations can help resolve conflict, can also cause conflict, but they're open, and of course helps with the grief process afterwards. I still remember this family, this beautiful man and his children. He, at the end of his life, got them all together and they all had this dinner with us, with me involved, basically just sitting there helping to facilitate what he wanted to say. But it was just talking about what it is that he wanted, how he wanted to be treated with pain. He wanted to be, you know, have his treatment, that he was, you know, not completely knocked out. So there's this opportunity to have these early conversations. But I believe, you know, I really think that the earlier, the better, right back before anybody's dying or gets sick, that they can actually have that. But culturally, you know, it's not a real good look to talk about death and dying. The next one, thanks, James. Also, I guess the really things that I've noticed that some people have never discussed anything with their families until illness and they're facing death. Like there's so many disclosures, and it's like sometimes it's really difficult when you're in the health service to actually to know this, but there's an ability of, I guess, an awareness of where people might be. And often it's someone else that they may disclose things to. And that is, you know, what matters most is that they're forgiven or that they need to forgive. And often, and I've had quite a few people know that they've done something in their lives that they just can't feel that they can forgive themselves for. They don't want to open it up to the family, but they actually need to find someone who can help forgive them, particularly around significant issues. Also around financial concerns, opening up that there could be things that they really haven't let somebody know. So it's the conversations and having support around having those conversations, the fear of what will happen next. So again, coming back to what's most important is relationships often, and how people can actually deal with what's happened in their life. Next one, thanks, James. So to navigate the health system. So advanced care planning is for everyone. It's like it's for all of us. Like we can actually think about it and write it, you know, contact, get these forms, think about it, have a discussion. It's not really just for people who are aging or people who've found that they have a serious illness. It's for us all, you know, because particularly with COVID and what's happened around with COVID, you know, people aren't even getting an opportunity to talk with their families really. They're just really sick, end up in intensive care, and that's been really difficult to know then what people really want and need. And it's usually connection with family and also people who die in a car accident or a motorbike accident or suddenly have something happen to them. It's like you know, what did they want? What did they need? What would they need in their lives? So actually, because these things are happening around advanced care planning, it can actually give confidence that when it matters most, your wishes about what matters most will be known, even the emotional stuff, even the spiritual stuff, you know, that there's an ongoing conversation, not just this one form to fill out, but there's an ongoing conversation because things change, that actually your comfort is really thought about, you know, when you're in, that your pain and treatment is appropriate. So, and that there's clear, concise information from everyone. There was an indicator that this is what can happen in hospital systems too, is that this family were waiting for the father to die. They thought he had more time. They thought that he was dying. He would die within the next 24 hours, but it wasn't clearly spoken about because people were then, us workers, were scared of actually saying that death is going to be happening in the next 24 hours. So this family were going to go home and thinking they were taking him home. So clear, concise information, because what those people wanted was to be with him, what people want, what, you know, in this area. So really conversations with the healthcare team is so important and on a continuous basis, but that takes confidence, and maybe there needs to be lots of advocacy around that. Next one. I don't know. Right, I'm going to finish anyway. But I don't know if anybody knows this beautiful book called The 4 Things That Matter Most. It's a book about living and the 4 simple but powerful statements. And it could sound a bit corny, but to me, they are really beautiful things to say, and they've worked in lots of interesting ways when I've been able to say to somebody who just can't stand talking about things, but needs to be forgiven or needs to ask for forgiveness. And, you know, saying, please forgive me, I forgive you. Thank you for being who you are in my life, and I love you, are really powerful statements that can actually help people open up conversations. But I find that the most important things, these 4 powerful statements, can be there right from right now when you're not sick, you're not thinking that you're going to die, but that always, you know, I was thinking about that, about with my grandchildren, please forgive me, because sometimes grandma's really cranky, you know. I forgive you for doing whatever you did. Thank you for being such a beautiful little boy or little girl, and I love you. So these constant kind of statements can open up so many things, and I've seen that happen. And I guess, you know, it's a different, it's what people most want, I guess, is to know that they're loved, that they're appreciated, that they're safe and supported. And I think, you know, having some kind of early conversations and all the things that link in, advanced care planning, statement of choices, all these, but the conversations need to start with us, with ourselves, as practitioners, as people within our families. It's almost like we can't expect our, you know, clients out there to start talking about stuff when we don't talk about it. So I think that's all I've got to say, really. And hopefully I have some, that some reading that I've put up is Ira Byock and Joan Halifax. So I'm really looking forward to any questions if there are any. And thank you very much for having me.
Thank you so much, Jeannie, and also to Shay. Jeannie, I always go home with a book list after I hear you talk of things to follow up afterwards. So thank you, and I think some really beautiful storytelling as part of the value of this space is really wonderful. So thank you so much there. So now we're heading into the question and answer area. So if anyone have any questions, pop them in the Q&A. Just hover over the section at the bottom and you'll see Q&A. You can also put them in the chat if you can't find the other area. Happy to, you know, respond to either of those. But I might just open up with the question to both. Maybe the first one to Shay. Shay, you talked about, I think the words you used was, talk about it later. Let's talk about this later. And I think we often hear that in this space around putting things off for a future date in that space. So I know that sometimes I find that having those conversations with other people, you can tell it's difficult, and you know, they'll keep putting it off. But I really would like to try and actually open up the discussions now. Have you got some handy hints if you find that if someone keeps saying, oh, let's talk about it later, how you can maybe approach that or respond to that?
Yes, I think some of the more practical aspects, obviously there's something there that's driving that delay. And so I think you probably need to change your tact. And so sometimes when that happens in our hospital setting, we can sort of spin things around a little bit and just start with gentle conversation. So, you know, not really engaging in the specifics, we need to do this form because, by going, oh, have you thought about, you know, what are you going to be doing in the next 2 weeks? So what about the next month? And have you thought about how this might happen? And I think if you change the approach to a less of a confrontational question and just more of a discussion, that might then lead somewhere. But ultimately, it can be really, really difficult. And some people just don't want to have that conversation. And it is their right not to do that as well. So it is quite a balance, and it's not always easy.
Excellent. Yeah, I think I love that concept, just changing tacks, reframing it, you know, doing things. I think that's a really practical response in that space. And yeah, it is hard sometimes, isn't it, when you know, if they don't want to go there, and how that's okay too. You know, we've got to acknowledge that we can't, it can almost be a bit more of a burden by going there for someone, you know, and that's not what we want to do either. I think, Jeannie, I was going to ask you something that you said. I really like the phrase around sometimes the real conversations aren't happening. And I thought that was a really interesting way to frame it. And I guess my background is a palliative care nurse. And so I'm very practical. Often in nursing, we're trained to be practical and we're trained to do our tasks. And, you know, that's the easy side almost in a way. So, and I think that's something that a lot of people feel, what can I physically do in this space to help? But sometimes those deeper conversations is actually what needs to happen in that space. Do you have any suggestions around how to move from the practical elements into a bit of those deeper, important conversations?
The only thing I can think of, Sharda, is that to ask the person who they are and what, you know, just to get to know somebody, and then to really be genuinely interested in them, about what is meaningful in their life and who's in their life, and, you know, like those conversations, and then introducing the documents or the practical stuff. You know, it's about getting that connection, that rapport. And often nurses don't have the actual time to do that, but, you know, there might be someone else on staff that can, you know, that can actually connect. But I really think it's about maybe, and of course people do that, they just say, about yourself, what's going on, anything, you know, like maybe that's the way. That's another tactic I think Shane might have been talking about. So yeah,
wonderful, thank you. And just a reminder to anyone, if you've got any specific questions, please pop them in. I can see that one's come through in the chat. So what was the cultivating compassion reference? Jeannie, this one's for you.
Okay, it's just me doing this Zoom thing, unmuting, stopping my video. It's just the book actually that I really, it's Being with Dying, it's called. I probably didn't put that up, but it's Joan Halifax's book around being with dying, and the way she actually looks at cultivating the compassion within yourself, I guess, and about yourself, and then about the other. So I hope that answers the question. It's just part of the title, and I've missed actually the being with dying part of that, so I'll put that in. So sorry about that, but it is, I guess it is about compassion in ways of actually becoming more aware of, you know, how difficult it is. It's like death is really sometimes very difficult, and dying is too. So there needs to be that compassion between, you know, ourselves, for ourselves and for others. And I saw somebody put in dignity to the dying. Yeah. And dignity with art for ourselves when we're working with the dying. I hope that answers the question.
Yeah, well said. And I should also just bit of a promo there. We have a PaliLearn course that is called How to Nurture Compassion, and it looks into a lot of these compassion theories and cultivating compassion methods and things like that, really practical examples. So if you are interested in that space, it's a lovely course to participate in, just 1 hour course. I think the other thing, Shay, I was going to ask you back to my practical questions, a question there around so the statement of choice. Personally, I'm very biased. I think we're very lucky in Queensland to have the statement of choice documents, and they're fabulous tools, and I really love the way they go into your values and all of that sort of thing. So it expresses a bit about the who. Sometimes though, you might go into your GP or different groups to talk about these documents, and they don't know what they are. Now, this is not their fault at all, and we're not blaming that, because as you can imagine, they have to keep on top of all of these documents in healthcare, so it can be quite hard. So if you have a statement of choice document that you've downloaded and you've got access to, you've completed it, and you go to your GP or your health provider and they're not aware about it, how do you think you could start that conversation with them around starting, what you want to talk about in this space?
How the patient could start conversation with the doctor?
Yes.
Oh, that's a very difficult question. I would hand them the form and say, let's talk about this. I think GPs are very, very switched on, though. I think that they have a very good understanding of the processes, and I think that they would be able to look at one of those forms and make it's a very easy form to fill out, and this is why it was particularly designed this way, and this is why it's so popular. It is very straightforward, it is very clear to the point, and it is very good to understand. If that were the case, though, and the doctor really didn't perhaps needed a little bit more guidance, then I would sort of refer to the Office of Advanced Care Planning, because, they could give them a call. We've got staff on there, both medical and nursing staff, that could engage with that medical practice and the doctor, give some education over the phone, but they could also do some follow-up so that GP practice could then solidify some of that knowledge around advanced care planning as well. So there could be a flow-on effect. But yeah, certainly use the Office of Advanced Care Planning as a resource. That's what we're there for, and that we're more than happy to provide that if it was required.
Well said, definitely there. I mean, it's such a fabulous resource. I still, I'm so impressed that our government really focuses and values advanced care planning and the team around this space to really enable that access there. And so exactly that, taking the document, this is what it's about. And you've been brave to have those conversations, and it's around the next steps of that. So it's really wonderful in that space. So I'll just see if there's any other questions in there. There's nothing come through yet, which is, look at that, guys. You did such a great job in your presentations that there hasn't been too many questions in that space. So we might just wrap up with one last question to each of the panelists about what's one take-home message that you think would be good for people to think about in a National Advanced Care Planning Week. So first to you, Shay.
Oh, well, mine has to be that you will absolutely never regret the conversations you do have, but you might regret the conversations you don't. So start today.
Well said. That was awesome. Over to you, Jeannie.
I think that I would actually really having a look at those statements, the obvious statements of actually opening up those conversations, even if they're very, really difficult. Only that when I was doing this, I was thinking, those statements are so obvious, people will talk about them. But I think intentionally talking with your families about what is the most important thing for them could be really helpful, just by even saying one thing, thanks for being around, or or even talking about your own illness or death, or I guess that's what I have the conversation, similar to what Shay was saying, that actually I really do like those statements. And I wouldn't have said that a little while ago, but I do. I think they're very powerful. That's what I'd like you to take back home with you.
Wonderful. And that's so great to hear. I think it's around reducing that fear of the conversation and just starting it, because they're really important conversations that we all need in life, no matter what age, which really came through in both your presentations. And Just from my side, just a huge thank you for these beautiful people sharing their wisdom and their experience and their knowledge in this space. And a big thank you for everyone here that attended today, that is keeping yourselves up to date. That's such a gift to you and your families and your community as well around you, by learning about this space and starting conversations as well for yourself. I would also just like to thank those behind the scenes that have been putting this together, both James and Megan and the other staff at PCQ that have done such a great job in this space and is doing so much about enabling conversations about advanced care planning and putting on these free webinars for the community. We also have we can't do these events obviously without our membership as our independent non-profit charity. So if people are interested in becoming a member, they're open to all community members or all organisations as well. So you can see the more details on there as well. So if you'd like a certificate of attendance to attend one of these events, you can just simply email us at hello@palliativecareqld.org.au and we can arrange a certificate of attendance for you in that space. We will be sharing an evaluation form with you after this session, so really appreciate you taking a little bit of time just to quickly complete it. It's not long, but it does help us to demonstrate that these are beneficial or not, or any learning that we have in that space so that we can continuously improve what we do. So really appreciate that too. So if you want to stay connected and learn about up-and-coming events and webinars and activities that we have on, please jump onto our website. James put the details in the chat before, and he's also just magically done it now. Also, we have our fancy QR code on the screen at the moment, so you can do it directly through your phone or anything in that space. We do like to keep these presentations available for others to keep learning in this space, so we will make this available on our YouTube channel for our members to get access to in an ongoing way as well. So just to wrap up, a huge thank you to both Jeannie and Shay for sharing their time and their knowledge in this space. I know it's a very busy week for both of you in this space, and so just yeah, really appreciate that on behalf of all of Palliative Care Queensland. And thank you to you all as well. And I really look forward to you all starting conversations openly, demystifying this space and making sure people know what matters most to you and you know what matters most to your loved ones as well. Thank you all and have a beautiful day.